Now, they're free in Wales and soon will be in Scotland and Ireland, but here in England we still have to pay for prescriptions. But in September 2008, Gordon Brown promised to abolish prescription charges for all people with long-term illnesses. But time is running out. If a new law is not passed before the election's called, many fear it'll never happen. Well, now charities and MPs are calling on the PM to make good on his promise. To look at Andrew Hoodless, he's no different to any other 20-year-old.
Football, very passionate about football. I've had support with Bolton Wanderers for my sins, I think.
But Andrew has cystic fibrosis and his life expectancy is 35 years old.
I try not to let it ruin my life as much as possible, but obviously with the medication and countless other things, hospital visits, it does tend to overrun. But I just try and live each day as it is, to the full, and try and keep my CF down to a minimum.
Despite that, even playing on the Wii Fit with his friend Sam can take it out of him. But staying fit is essential, and so are the mountains of pills he has to take every day.
I think on average I take about 45 tablets a day. These are antibiotics, a group of vitamins, my inhaler just in case I need it, and then these are for when I eat, and they're just for digesting my food properly.
So 45 tablets every day, and you have to pay for these?
Yes. Luckily, I've got a prepaid prescription, which is about £110 a year, which covers me for all my medication. But if that runs out and I forget to renew it, then it's about £7.55 per medication.
Andrew has now set up a Facebook campaign. 2,000 people have signed up, supporting his call for free prescriptions for cystic fibrosis sufferers. But it's an issue that affects millions of people. In 1968, the Labour government introduced a number of changes to prescription charges. The young, the old, people on benefits and a few people with chronic illnesses like diabetes no longer had to pay for medication. But very little has moved on since, and now many people are calling for a radical change. Eileen MacDonald was diagnosed with rheumatoid arthritis 26 years ago. Like Andrew, she too pays for her prescriptions.
If I wasn't able to access my medication, the quality of life that I would have would just be virtually zero.
She had to give up work 13 years ago and now helps other people with long-term illnesses in Warrington. Have you found that people have had to make really quite stark choices when it comes to finances?
Yes, they have to make the choice. Do I feed myself today? Do I keep my house warm today? Or do I take my medication?
182 MPs have now signed an early day motion demanding Gordon Brown stick to a pledge he made in 2008 to make medicine for long-term illnesses free. But now some fear it'll be spiked until after the election. The British Medical Association is calling on the government to go one step further and follow Wales by giving free medicine for all.
The exemption system is unfair, illogical, produces winners and losers. And if you just want to extend that system, I don't think it will deliver what is really required of it.
If any decision is delayed until after the election, the pressure will inevitably fall on the next government to make the changes. The argument's unlikely to go away.
The medication that they take is to keep them alive. Without it, they would die. So why should we have to pay for the privilege to be alive when nobody else has to?
Well, joining me now in the studio is the MP for Wirral West, Stephen Hesford, and the Conservative candidate, Paul Maynard, who's the candidate for Blackpool North and Cleveleys. Stephen, if I can come to you first of all, we did ask Andy Burnham to come onto the programme. He couldn't, but he sent us a statement saying that the Prime Minister had said that when the NHS generates cash savings in its drugs budget, that money will be ploughed back into abolishing charges for all patients with long-term conditions. Now, that was in September 2008. Nothing has happened yet. What's happened to that promise?
Well, first of all, let's acknowledge that the government are examining the issue.
But it's taking an awfully long time.
Well, let's just acknowledge the government are examining the issue. What the government have done since is they've produced the Gilmore Committee, which has literally just reported to the department, and the department are now looking at that. There's been a change in policy since the 2008 statement, and I think that should be taken into account. The original policy was that this should be a cash-neutral policy. The government have taken on board and asked the Gilmore Committee to look at this, that it will not now be a cash neutral position, it's a cash spending position.
What does that actually mean?
That if there was a change, that we're not afraid to spend more money in making prescriptions free.
The thing that people are going to...
If that's what we go forward with.
The thing that people are going to be asking, though, is that this seems to have dragged on for such a long time. We're now very close to an election being called. If it isn't made into law before the election is called, what's going to happen then? It'll just go into Labour's manifesto. And, well, OK, I'll ask Paul Maynard. If it doesn't happen before the election, will the Conservatives abolish prescription charges?
I think we're as keen to see the outcome of the Gilmore Review as all the other charities that are campaigning for free prescriptions are. If you ask me, I have cerebral palsy, I have epilepsy. The epilepsy entitles me to free prescriptions. Do I feel comfortable that I can get those because I have an exempt condition, but young Andrew that we saw on the film doesn't? I have to say I feel uncomfortable. But we need to know why the government has sat upon this report. He finished it back in the summer. Three was sent away to do some more work. You know, we're as keen to see the results as everybody else is. OK,
but David Cameron says you are the party of the NHS. So if that's the case, do you think that the Conservatives will abolish prescription charges?
I think it's very easy to say that the whole issue of long-term medical conditions can be solved just by applying free prescription charges for everybody. Many people who are pensionable or under 18 get them free anyway, so we're talking about a comparatively small number. But long-term medical conditions are about more than just that. In my constituency, 42% of people, according to the last census, lived in a household where somebody had a long-term medical condition. It isn't just about the individual concerned, it's about the carers that look after them as well.
I think Paul, in a very roundabout way, is not promising under a Conservative government.
Well, I certainly didn't hear a promise there.
No, you didn't, and you won't.
But let me go back to asking you.
No, Annabelle, it's important to understand that this is the direction of travel for this government. Whether or not we can legislate in the time available, I think we will eventually...
But you'll be letting people down if you don't, because then if Labour get in again, it just goes back into the manifesto.
No, I agree. I want us to legislate. But if we didn't, it will go back into the manifesto, and we will do it at some point.
But it should have been done before. You've had a long time. You've had since 2008.
It's a complex issue. We are making sure that it's affordable, and we get this right. It's not something that we want to revisit once we've done it, and I think we will do it, given time. OK, gentlemen.
Paul, particularly, thank you very much. Just, if I can, Stephen, as you're here, you announced, and we announced on the programme last week, that you're not going to stand at the next election.
Right, yes.
Now, many people might say, is that because you don't want to lose against the Conservative candidate, Esther McVeigh?
No, that's ridiculous.
You've got a very small majority.
I've got a small majority.
And notionally, it's a Conservative seat now because of boundary changes.
Well, you may say that, and you know you can play politics with it. It's got nothing to do with it. If I'd made that calculation, I would have stepped down a long time ago because these figures have been known for
come on, tell us why.
4 or 5 years.
What are your reasons?
It's really family reasons. Taking stock of where we are as a family, where I am in my life, I've decided that it's time I moved on to pastures new. I think the seat is eminently winnable for Labour, and in a few weeks' time we will select a brand new candidate, and I will be backing that person, female or male.
Do you have any regrets?
Of course. It's been a fantastic honour. I've met marvellous people, dealt with lots of constituency cases, some successfully, some not, but it's been an honour, and I've been able to talk to people like you over the years, and yes, I will miss that.
Thank you very much.
Thank you.
Good luck in the future. Both gentlemen, thank you very much for coming in today. That's all from us for this week. Don't forget, if you want to get in touch with us about any of the issues that we talked about today, or perhaps you have a story that you'd like us to look into, then go to the website. That's bbc.co.uk/politicsshow, and follow the links to the North West. Thank you very much to all my guests today. Thank you very much for watching. And now it's back to John Sopel in Davos. Bye-bye.